Today we're going to introduce Voluma. Voluma is the brand new FDA-approved hyaluronic acid from the makers of Juvederm Botox Allergan. This hyaluronic acid is the first FDA-approved mid-cheek injectable. It is a more robust, thicker hyaluronic acid. It has the new Vicross technology. It's a more elastic hyaluronic acid, and it's FDA-approved up to 24 months. We realize nowadays most people don't have a deep nasolabial fold problem. We all have a deflating cheek problem. So the more we can lift the cheeks, it's a more natural correction of the volume loss that's causing all the aging most of us are having. That's the theory. Most of us are having a lot of sinking and sagging. So the more we can volumize the face with all these fillers and address the mid-cheek, which in the past was not addressed like it is nowadays, we're going to have less product in the nasolabial fold and a more long-lasting product in the cheek and the mid-cheek area. Today, Annie's my patient, and she actually has genetically great apples of her cheeks. We're going to prioritize her Voluma today and the apex of the cheek, because this is the area that'll give her a nice lift, and it's an area that will look good from her side profile as well, and it'll lift the corners of the mouth. We did do a topical numbing cream before we're doing the injectables, and the Voluma, just like Juvederm, does have a lidocaine in it. Basically with the Voluma, this hyaluronic acid, it is thicker. It lasts up to 24 months. We utilize a 27 gauge needle. And we're going to do a perpendicular injection. We're actually going to go down to periosteum, and we're going to do a little aliquots product to lift this area. She's been numbing with benzocaine, lidocaine, tetracaine numbing cream for about 15 minutes. We also ice before we do injectables, anything that's going to vasoconstrict and minimize bruising with the needles we're going to utilize and to make it more comfortable for the patient. So we're going to ice this location, and then we're going to inject. Fillers are immediate gratification. It feels like a tiny little bee sting. So we're just landmarking down to periosteum. So our first injection is going to be right in this location. You're going down to periosteum, you will feel it, and you're going to put about 0.2, and you can actually go adjacent to that and place another 0.2. And then with products, you want to lightly massage them. When you know fair what that product is, you want to make sure there's no lumps or bumps. Make sure it's nice and smooth. And you're always constantly assessing your patient. Before you ever do any fillers, both sides of the face are sisters, not twins. Usually the side that people favor in sleep, or sometimes the left side of the face that gets more sun damage, decades of driving, you're going to volumize based on where they need it. So don't be surprised if you actually put 60% of product on one side and 40% on the other side. Because the key with fillers is to make patients more symmetrical, because most of your patients walking into the practice are very asymmetrical. We are naturally, but with fillers we can make us 99% more symmetrical. And a lot of times your patients will point out to you where they have the most volume loss. Little pinch again, little higher up. And it's little tit pulls with the Voluma. Just massaging that product again, and then we're going to go to the opposite side and do the same thing along this apex of the cheek. We do tell patients to avoid aspirin or ibuprofen prior to injectables. That can help minimize any bruising. But a little bit of swelling is normal. Hyaluronic acid is hydrophilic, so it pulls water into the product, so everybody will swell a little bit. I always say filler looks great when you leave the practice, but it looks even better in 48 hours. So all we've actually done with the Voluma is do a half a syringe here and a half a syringe here. Now keep in mind, the average correction for Voluma is one syringe. But in Annie's case, she once again has great cheeks. She doesn't have a deep malar crease, so we were just trying to just give her a little bit more lift in the apex of the cheek, kind of where she puts her blush. So she's a little bit puffy, but actually we technically consider this no downtime because she's just a little bit red, a little bit swollen, and it's a very comfortable injection because there's lidocaine in the product. Post-procedural, we would just give ice, and we apply vitamin K cream that can minimize bruising by 40% if you massage that a few days after the procedure. She can put makeup on and sunblock immediately after this procedure. The main thing is ice and a little vitamin K cream. Next, we're going to demonstrate injecting the temporal fossas. We're going to utilize Juvederm, and again, it's a hyaluronic acid. Temporal fossas are a very common place to inject because we're assessing the upper part of the face more for volume loss, muscle atrophy. This area people can have a gaunt appearance. So lateral to the eye and above the ear. Great place about the temporal fossas when you inject this area. It's going to help volumize, and it's going to help make a more youthful appearance. The key with the temporal fossa is you're going to do a perpendicular vertical type injection. You need to bypass the temporal artery for safety reasons. So you're going to take that needle, you're going to switch your Juvederm or Restylane. Hyaluronic acids are safest for the temporal fossa, and switch to a 1 cc, either 27 gauge or 25 gauge is fine, but you want to make sure you go deep. You want to go down to periosteum. Once you do tap on that periosteum lightly, you want to slightly aspirate. Make sure you bypass any of the temporal arteries or any of the vascularity there. Again, we want to avoid any possibility of a vascular occlusion, and then you want to inject in that area, a slow injection. Average correction for temporal fossas is 1 cc per fossa. We're going to ice the air before we inject. We've actually applied a topical BLT cream prior to injections, and the ice will help for comfort and help vasoconstrict. We're going to stabilize the head. Rest your head back. Before you inject, do assess the vascularity. You want to avoid the vessels. And again, just have patient placement. You want to stay lateral to the eye, above the ear. And for new injectors that are actually never done the temporal fossa, you're going to feel that fossa. You're going to take and you can feel the depth of that fossa, and you're going to be safer staying around the hairline with doing the injectables in the temporal fossa. And again, go deep. That's where you're safest. So you're going to take a tiny little pinch, go all the way down to bone. You'll feel a little crunch. You're going to slightly aspirate. Sometimes it's difficult to aspirate in that area, and they're going to slowly inject. And you're going to do this in a few points of injection. So you're going to remove that, put some slight pressure, and then you're going to move up the hairline, inject again. It feels a little strange, and your patients might feel a little crunch. Explain to them that's normal, and put a little pressure. My patient Deborah's actually done temporal fossas in the past. We're only going to do 0.5 cc's per fossa because she has a good correction at this point. And then you're just going to basically put some pressure on this area and ice it. No bleeding. She had a good correction, and you can show the patient in the mirror. And then as you wait, something you can just work your way up. But then again, most important aspect of the temporal fossas is avoid the artery, go deep, and stay as lateral to the hairline as you can for safety.